Dr. Vikki Petersen here. I wanted to speak with you today about IBS, irritable bowel syndrome, also known as IBD, irritable bowel disease. The symptoms associated with this are pain, bloating, gas, constipation, diarrhea. Sometimes the constipation and diarrhea are alternating. Sometimes one is more prevalent than the other. But this is a disease that affects 20%, it's estimated, of our population. What's surprising is that 70% of those affected seek no help for their problem and instead just choose to live with it. This is a serious problem, not to mention the 30% that do seek out help and are told what they're told is that there's no solution. There is no cure to their problem, and they have to live with it. They can take medications to try to offset some of the symptoms, but it's just something they have to live with. The way this disease impacts someone's life is very, very severe. In my over 20 years of being in practice, I've seen patients that were all but housebound because of this problem. Yet, in my 20-some-odd years of practice, I seriously cannot think of a single patient who has sought help here at the clinic and has not been helped. And very often the underlying cause is a gluten sensitivity. Now, that shouldn't be too big a stretch because a lot of the things we talk about are the fact that the majority of the time gluten-sensitive patients don't have digestive symptoms, and that's the stretch. That's the thing that maybe doesn't make intuitive sense. But certainly, digestive complaints should lead one to think in that direction, but unfortunately, that's not the case. So they continue to suffer. It's estimated that 20 to 25% of all gluten-sensitive patients have also concurrent IBS, and this is as opposed to only 5 to 10% in a healthy, normal population suffer from IBS. So the percentage is more than double in those with gluten sensitivity. So it has to be something that we really look at. When someone is suffering from IBS, they're not absorbing their nutrition as well as they should. This will set them up for a myriad of nutrition deficiencies, considering vitamin D being a part of that, iron deficiency, calcium deficiency, decreased fat absorption, which results in hormonal imbalance, such as depression and anxiety, which is very associated with IBS, having depression and anxiety. And it can be associated because of the malabsorption, as I mentioned, not to mention what we talked about earlier, the lifestyle impact, what it's like to have to always know where a bathroom is, to not go too far from home, to be afraid to travel, to be embarrassed by having an accident. These things are very serious, and of course the health associations that go with it are equally serious. So I wanted to talk about this today because it's something we've had a tremendous amount of success with. There is recent research that points to the fact that every person diagnosed with IBS really should be checked for gluten sensitivity, and I am fully in agreement with that. So I hope this helps you or someone that you know, and until next time, to your very good health.